Okay, so today we're doing a deep dive into 6 quite different articles, giving us a real cross-section of what's happening in India.
Yeah, it's a real mix. We've got tech innovation popping up outside the usual hubs. Then we're looking at Bihar's population dynamics.
Right, and a pretty big Supreme Court ruling on digital access, plus empowering nurses, a crackdown on kids' cough syrup.
And finally, the very complex and ongoing situation in Manipur. So a lot to cover.
Definitely. Let's jump right in with that first one about Belagavi.
Okay, so this piece looks at how tech companies are actually doing really well outside the big cities, using Belagavi in Karnataka as the main example.
Hmm.
It kind of pushes back against the idea that everything important in tech has to happen in, say, Bengaluru.
It really does. I mean, take ProSoft. The article mentions they've been around 25 years, working from, what, a 2 BHK flat?
Yeah, sounds tiny, but they're making software tools for major law enforcement agencies, NIA, CID, ED. It's serious stuff.
And that C5 CDR analyzer they developed, it's used across the whole state of Karnataka for call data analysis. That's significant reach.
Absolutely. Their CEO, Mohsen Daliat, talks about not just the tech, but also, cybercrime awareness and helping agencies make quick decisions with data.
And there's even a quote from a senior IPS officer, B. Dayananda, saying their software has genuinely helped solve cases. It makes you wonder what other hidden gems are out there.
Good point. Then there's Shrestha IT. They're all about cybersecurity and threat intelligence. Super important field right now.
Their CEO, Swapnil Patnakar, stresses their proactive work finding threats before they hit. Things like pig butchering scams, crypto fraud, phishing, the works.
And get this, they protect over 50,000 government and private websites. Indian Railways, NIXI. Major infrastructure relies on them. That's quite a responsibility.
It is. And it's not just software, is it? There's Hitesh Dharmadasani's company making hardware firewalls, routers.
Right, actual physical network security products. And they're competing internationally, mostly against U.S. and Israeli companies.
And most of their team, 7 out of 10, are based right there in Belagavi. That's pretty remarkable.
We also see companies like Viavia Labs working on really advanced stuff like digital twins and validation for self-driving car technology.
Plus, entrepreneurs like Ajit Patil branching out internet services, cloud, even electric bikes with Revolt RV1, and someone making 3D printers too, Virendra Kadam. It's quite diverse.
Yeah, and Amy Cattle's company even has an MOU with Samsung for mobile software. You've also got startups like Sensei's, EcoBills, AXA Infotech mentioned. It feels like a real ecosystem.
One thing that comes through is the advantage of being outside Bengaluru. Less traffic, for one.
Definitely. Swapnil Patnakar mentions his team getting back from lunch way quicker than they would in the city chaos. That flexibility seems to be a real plus.
And these entrepreneurs seem really connected to the local community too, don't they? Offering free consulting, helping out during COVID.
Yeah, like Dharmadasani helping the district with data analysis during the pandemic. It's not just about their own bottom line.
There's mention of efforts by R.K. Patil and Ajit Patil and this group, BayTCA, really trying to build up that local entrepreneurial spirit.
Ajit Patil even talks about wanting to prove that Tier 2 towns can be innovation hubs and plans to fund an EV Center of Excellence at VTU, the local university.
And VTU itself seems to be playing a role, with initiatives to encourage student startups.
Though there's a note of caution, too. Rohan Javali suggests more government support is needed for this whole beyond Bengaluru idea to really take off. Makes sense.
Okay, let's shift focus now to the second article. This one tackles Bihar's high total fertility rate, or TFR.
Right, the TFR, the average number of kids a woman is expected to have. Bihar's was 3.0 back in 2021, while the national average was down to 2.0, so quite a difference.
Yeah, Delhi and West Bengal were way down at 1.4. The big question the article asks is it just about poverty?
Well, Saswata Ghosh makes some interesting points. He notes Bihar's TFR has been stuck around 3.0 for like 6 or 7 years, and projections suggest it won't hit the replacement level of 2.1 until maybe 2039. That's quite a long way off.
And this is despite improvements, right? Infant mortality is down, women's education is up, but TFR stays high.
Exactly. Ghosh argues that while poverty is linked, it's not the whole story. He talks about a culture of high fertility. He points to NFHS data showing fewer women in Bihar. Only about half think 2 children is ideal compared to over 2/3 nationally.
That's a significant difference in attitude. And even though the poverty rate measured by the MPI has supposedly dropped, the TFR hasn't followed suit immediately.
Which suggests, yeah, that poverty alone doesn't explain it all.
But Prasenjit Bose brings in a bit more nuance, doesn't he? He says these are complex socioeconomic things, and poverty measures aren't perfect anyway.
Right. He agrees culture matters, but says we also need to look at things the MPI might miss, like urbanization, real job opportunities, different ways to earn a living.
He does make the point, though, that both poverty and TFR are generally heading downward, so there's a connection, even if it's not simple.
Yeah, the direction is the same. Now, the urban-rural gap is also revealing. Well, nationally, the gap between rural and urban TFR is about zero point 0.6 children. In Bihar, it's wider, zero point 0.8. But the really striking figure is Bihar's urban TFR. It's 2.3. That's much higher than the all-India urban average of just 1.6.
Wow. So even in cities in Bihar, families are larger on average than in cities elsewhere.
Exactly. Ghosh brings in this idea from demographer Ansley Cole about fertility being a calculus of conscious choice. The high urban TFR suggests it's not just circumstance, maybe it's a deliberate choice for larger families, even in urban settings.
What about other factors, like wanting sons or the agricultural economy?
Bose touches on that. He argues that poverty and lack of opportunity do influence cultural choices. If you're in agriculture, maybe more kids mean more hands for labor.
That makes sense. Bihar's economy isn't heavily industrialized, lots of surplus labor, migration. He links it all to low literacy and issues in the education system, too.
It's all interconnected, and female literacy is a big piece. Bihar's rates are low.
Ghosh mentions CM Nitish Kumar's focus on educating girls to bring down fertility.
And the data does show that. More education, more household wealth, generally lower TFR.
But it's complex. Ghosh's research found something interesting about mother-in-laws, right?
Yeah, how they sometimes mediate between younger women and health workers, like ASHAs. This could limit the younger woman's own choices about family size or contraception. It shows how family dynamics play a role.
And this whole issue has political dimensions, too, especially with parliamentary seat delimitation potentially coming up.
Bose points that out. States like Bihar, UP, MP, Rajasthan, the Hindi heartland, have a large and growing share of the population due to higher TFR.
So after delimitation, they could end up with disproportionately large constituencies or maybe more seats.
Potentially. And it raises the question, will states that successfully lower their TFR be sort of punished in terms of representation or resource allocation because they have fewer people now?
It's a tricky balance. Bose argues for policies that help fertility rates converge across the country. He comes back to the idea that poverty and lack of opportunity really shape those cultural choices about family size.
It's a really tangled issue.
Okay, moving on to our third topic. This is about the Supreme Court and the right to digital access.
Yeah, a significant ruling. The court basically reinterpreted Article 21, the right to life and liberty, to include digital access. This came up in a case about KYC norms for persons with disabilities, or PWDs.
KYC being know your customer, the identity verification banks and others have to list.
Exactly. And the ruling connects back to the Rights of Persons with Disabilities Act from 2016. That law uses a social barrier model.
Meaning disability isn't just about the person, but about how society creates barriers.
Precisely. Like needing a ramp isn't just the wheelchair user's issue. The lack of a ramp is the barrier society put up. Section 42 of the Act specifically talks about making media and electronics accessible audio descriptions, sign language, captions, universal design.
And KYC is essential, right? You need it for bank accounts, phone connections, government benefits. It's required under the Anti-Money Laundering Act.
Absolutely. The RBI even introduced a video-based customer identification process, VCIP, for remote verification. But the way it's been implemented, well, that's the problem.
How so? What are the barriers for PWDs?
The article lists quite a few. Things like relying on eye-blinking tech or reading flashing codes that obviously excludes people with visual impairments.
Right.
Asking people to write something and then take a selfie is tough for someone with motor disabilities affecting their hands.
Okay.
Plus, many KYC apps and websites just don't meet accessibility standards. No proper screen reader support, no audio cues, difficulty uploading documents.
And sometimes they don't accept thumb impressions, even on official documents like PAN cards.
Exactly. Or Aadhaar systems lack text-to-speech. And there was even an RBI rule against prompting during verification, which could hinder someone needing assistance. It basically shut many people out.
So what did the Supreme Court say?
They've been pretty consistent that accessibility for PWDs is a constitutional requirement. They referenced an earlier case, Rajiv Ratturi, linking accessibility directly to Article 21 life, dignity, freedom of movement.
And they brought this up during COVID vaccine registration too, didn't they?
Yes, emphasizing accessible digital registration then as well. In this latest ruling, they explicitly said These digital barriers violate PWD rights under international conventions like the UNCRPD and India's own laws.
And they use the term substantive equality. What does that mean here?
It means equality isn't just treating everyone identically. It's about ensuring everyone has a genuinely equal opportunity to participate. Sometimes that means different or additional measures are needed for certain groups to achieve that equal footing.
So the court basically told the authorities.
To revise the digital KYC rules with accessibility baked in from the start. Make it core, not an afterthought.
That seems huge.
It is. And the court also noted, importantly, that this digital divide isn't just about PWDs. Think about rural users, senior citizens, people with lower incomes, linguistic minorities. They face barriers too.
So by linking digital access to the fundamental right to life and liberty under Articles 14, 15, 21, and 38,
They've essentially put the onus on the state to ensure digital infrastructure is accessible, especially for marginalized communities. It frames digital access as a basic right, not just a convenience. Could be really transformative.
Okay, let's transition to healthcare now. Article 4 looks at empowering India's nurses.
Right. Nurses make up almost half the health workforce, nearly 47%, but the article argues they're often underutilized, especially in leadership and more autonomous clinical roles.
There's still this perception of nurses mainly as assistants, isn't there?
Very much so. But globally, there's a big trend towards nurse practitioners, or NPs. These are highly trained nurses, usually with master's degrees, who can diagnose, treat, and often prescribe medication independently.
Which countries have really embraced this?
The article lists quite a few: Australia, the US, UK, Canada, but also places like Botswana, Brazil, South Africa, Thailand, Zambia. It's pretty widespread.
Has India recognized this potential at all?
Yes, on paper. The National Health Policy in 2017 mentioned the need for NPs,
Mm-hmm.
and the Indian Nursing Council started programs like the NP in critical care, NPCC, and primary health care, NPPHC.
But the integration has been slow.
Very slow. Initiatives have struggled. The article mentions an NP in midwifery program in West Bengal hitting roadblocks. The core issue seems to be the lack of a clear legal framework.
So no defined scope of practice, no protected titles.
Exactly. Even when hospitals provide extra training for specialized roles like stoma care nurses, there's often no official regulatory backing or recognition for that extended role.
So what are the main challenges holding back the NP model in India?
Well, number one is that missing legal framework. What are they allowed to do? Can they prescribe? Who licenses them? Then there's resistance from some within the medical community.
Worries about hierarchy or scope creep.
Possibly. Plus, murky regulations, unclear career paths. It makes it hard for nurses to see a future in pursuing this advanced training. Another question is about getting these roles integrated into the public health system properly.
The article contrasts this with Australia's experience. What worked there?
Australia had a clear goal: improve healthcare access, especially in underserved areas, by giving nurses more autonomy. Critically, nursing organizations were heavily involved in policy discussions.
So they advocated effectively.
Yes, that led to laws protecting the NP title, setting up formal licensing, creating proper career ladders, and they had success with things like nurse-led walk-in clinics, which built public trust.
Why the resistance in India then? Is it just policy gaps?
It seems to be a mix. Policy gaps are huge, but also cultural biases. Gender issues. Nursing is still predominantly female and sometimes undervalued in entrenched hierarchies.
So opposition persists despite evidence that NPs provide good care.
Yes. The article cites evidence showing NP care outcomes are comparable to physicians, often with higher patient satisfaction and lower costs. But the resistance remains. Plus, there are broader issues with nursing education quality and regulation mentioned.
And the new National Nursing and Midwifery Commission Act, its impact is still unclear.
Seems so. And maybe a lack of strong, unified nursing movements pushing for change, unlike in Australia.
It's ironic, isn't it? Indian nurses often excel as NPs when they go abroad.
Absolutely. The potential is clearly there. The article really argues for a more collaborative, team-based approach here in India.
So what needs to happen?
Urgent reforms, basically.
Yeah.
Improve nursing education, clamp down on substandard colleges, boost faculty, bridge the gap between theory and practice, teach leadership skills, and critically give NPs legal recognition, define their scope, licensure, accountability, create clear career paths with fair pay, address the gender undervaluation.
And nurses themselves need to lead these reforms.
Yes, through sustained policy engagement. Maybe building stronger grassroots movements. The message is clear. Just saying thank you once a year isn't enough. Nurses need to be seen as leaders.
Okay, article number 5. This one's about a government crackdown on a common cough and cold medicine for young children.
Right. The government has restricted a specific fixed-dose combination, or FDC, containing chlorpheniramine maleate and phenylephrine hydrochloride for kids under 4.
That's an antihistamine and a decongestant combined, correct?
Yes. Chlorpheniramine is the antihistamine for runny nose. Phenylephrine is the decongestant for stuffiness. Manufacturers now have to put warnings on the labels, too.
Why the restriction?
The Health Ministry notification says a subject expert committee looked into it and found potential risks for children under 4, especially since safer alternatives exist.
How have doctors reacted? Pediatricians?
Largely positively, it seems. Dr. Rajathreya called the combination often irrational. Warning phenylephrine can mess with young kids' heart rate and blood pressure unpredictably. Dr. T.U. Sukumaran agreed, saying, older antihistamines like chlorpheniramine just aren't suitable for the under 4s due to potential complications.
And Dr. Vibhu Kawatra mentioned risks like respiratory depression or apnea, where breathing stops temporarily with these older antihistamines.
Exactly. And he also pointed out they're kind of redundant now because we have newer, safer options like cetirizine or fexofenadine.
So pediatricians seem on board, but what about pharmacists? Any confusion there?
Yeah, definitely some confusion. They weren't sure about honoring prescriptions written before the ban or what to do with stock they already had.
Did the courts get involved?
Yes, pharma companies went to the Delhi High Court. The court ruled the ban applies from April 15th onward, so it's prospective. Companies have to issue notices. Crucially, the court said no action should be taken regarding stock manufactured before that date.
So chemists can sell the older stock?
According to A. N. Mohan quoted in the article, yes, based on the court order. But B. Thirunavukarasu raised a point about the lack of formal communication to pharmacies, leaving retailers who legally bought stock in a tricky spot.
And there are enforcement challenges, too.
Anandan highlighted that in Tamil Nadu, for instance, there aren't enough drug inspectors to monitor all the pharmacies effectively. Plus, issues with unqualified staff dispensing medicine sometimes.
What's the general advice from pediatricians about coughs and colds in kids, then?
The main message is, don't just jump to medication. Try to figure out the cause first. Dr. Mohandas Nair points out most coughs are just viral upper respiratory infections that go away on their own. This FDC is often totally unnecessary and has side effects.
There can be other causes, though, right? Like asthma or reflux?
Yes, and those need different treatment. For simple colds, often basic home remedies, warm water, maybe honey for older kids are enough. Colds are usually viral, they just need time.
One doctor noted parents often get more stressed by the cough than the child does.
That's a good point. There's an effort to reduce unnecessary prescriptions. Dr. Kawatra strongly advises parents not to buy these syrups over the counter without seeing a doctor.
So the key now is getting the word out.
Absolutely. Madhab Karuna stresses the need to inform doctors and pharmacists widely about this ban to make sure it's actually followed, and these drugs aren't easily available for young kids anymore. Stringent protocols are needed.
Okay, our final article takes us to Manipur. The conflict there has now been going on for 2 years.
Yes, 2 years with no political settlement in sight. The human cost mentioned is stark, over 250 lives lost, thousands displaced, many for this entire 2-year period. Just devastating.
The author seems critical of the national response, or lack thereof, drawing a contrast with how other security incidents are handled.
Right. They contrast the lack of high-level visits to Manipur, specifically mentioning the Prime Minister, with swifter responses elsewhere, like after the Pahalgam terror strike. The piece suggests the approach to Manipur in the Northeast is often driven by, quote, an obsession with national security and regime consolidation.
But the author argues Manipur isn't quite like Kashmir in terms of the immediate national security threat.
Correct. While acknowledging historical foreign involvement with insurgent groups, Pakistan, China, the article claims that support is now much reduced, less direct. It argues the conflict doesn't pose the same kind of existential threat, despite efforts by some to frame it that way.
What efforts?
The article mentions attempts by some valley-based groups to blame Kuki militants crossing from Myanmar, citing an instance where intelligence reports about this were allegedly amplified or exaggerated last September.
And conversely, the author feels the response to valley-based insurgent groups, VBIGs, mobilizing has been muted.
That's the argument that since May 2023, there's been large-scale mobilization of VBIGs, and law and order was effectively outsourced to them in some areas, potentially undoing gains made years ago, like after Operation All Clear in 2004.
So the criticism is that security policy is focused more on appearances, on political optics, than substance.
That seems to be the core critique. Less focus on improving intelligence or counterinsurgency skills, more on actions that look decisive politically. Like the push to fence the Myanmar border and scrap the free movement regime, the author calls this obsolete security overdrive, potentially driven by majoritarian concerns and political interests rather than pure security logic, especially given Naga and Mizo opposition.
The article also raises concerns about weapons.
Yes, the large number of sophisticated arms that apparently got into the hands of various groups since the violence started. The author claims there hasn't been a serious, sustained effort to recover these, despite some publicized surrender ceremonies.
President's rule was eventually imposed, though.
Yes, but relatively late, in February 2025, apparently after internal issues within the state's ruling party. The author suggests this was maybe intended as a stern message against the violence finally.
So what's the path forward according to this analysis?
The conclusion is that a real return to normalcy needs serious political engagement. Addressing legitimate demands, rebuilding trust in state institutions, it requires moving beyond just political optics and focusing on substantive policy changes that can actually break the impasse. The piece notes rival parties were even commemorating the May 3 anniversary with different agendas, highlighting the deep divisions. It ends with a disclaimer that these views are personal and the stance on the national security aspect is problematic or debatable.
A really complex and sobering situation that covers our 6 articles for this deep dive. Thank you for listening. You can give suggestions by contacting on Twitter handle given in the episode description. We are always eager to hear what our listeners want to be informed about.